Welcome everyone. My name is Callie Kelsey, and I am the Community and School Education Advisor with the Transforming Mental Health Initiative here at Rady Children's Hospital, San Diego. I want to begin by first thanking the Dan McKinney Family YMCA for being our incredible community partners for today's presentation on the important topic of transforming youth mental health. Today's presentation is being recorded and will be made available at a later date. During the presentation, if you have any questions, you're welcome to add them into the Zoom chat and they will be answered during the Q&A session at the end of the webinar. Those participating in person, don't worry, you will also have a chance to ask questions during that time. Now, I have the honor of introducing the incredible Dr. Hilary Bowers. Dr. Bowers is the founding director of Behavioral and Mental Health Services at Children's Primary Care Medical Group. She is spearheading the CPCMG Mental Health Initiative to create centers of excellence to improve the delivery of mental health care to children and adolescents. CPCMG provides healthcare at 29 offices across San Diego and Riverside counties and serves the needs of 280,000 children. Dr. Bowers graduated magna cum laude from the University of Pennsylvania and received her medical degree from the University of Washington. While there, she performed early research on the efficacy of telemedicine to serve rural populations. She completed her internship and residency at Cedars-Sinai Medical Center in Los Angeles, with additional training at Boston Medical Center Division of Developmental and Behavioral Pediatrics, and is a board-certified pediatrician. Dr. Bowers has served in a number of capacities within CPCMG, including CPCMG's Board of Directors, Pharmacy and Therapeutics Committee, Telemedicine Task Force, and several others. Outside of CPCMG, she's been a member of the RCHSC, Pediatric Mental Health Integration Committee, and the EPIC Optimization Build Team. She also has been active with Children's Physicians Medical Group as a member of the Quality of Care Committee. Dr. Bowers, with her husband of 23 years, are the proud parents of 5 children. She has been active in numerous ways in their schools, chairing gala fundraisers, room parent, treasurer of PTO, and board member. In addition, she's always been an active member of their synagogue. Dr. Bowers has been an invited speaker to a number of multidisciplinary conferences addressing the delivery of behavioral and mental health care. In addition, she regularly interacts with Southern California's pediatric communities in a number of capacities. She is committed to bringing mental health care into the primary care home and is a passionate advocate for improved and timely access to quality pediatric behavioral and mental health care. Dr. Bowers, the time is now yours.
Thank you very much. I would also like to add to that I am a proud YMCA member. The Dan McKinney one is actually my home YMCA. So thank you very much for all that you provide to our community and for your part in keeping us safe and healthy and well, not just during the current times of the COVID-19 pandemic, but in the before times, as well as in the future. So thank you for joining us today. Our topic is very timely and very important for thinking about our children and adolescents and how does behavioral mental health care and physical health care combine to create true well care. We'll be talking about the current state of the mental health crisis and then things you can do to help your children and adolescents in your community, both within your home and in your greater schools and other activities. Next slide, please. When we talk about public health crises, often we talk about heart disease, we'll talk about breast cancer. And you can see on the slide, 1 out of 4 deaths are related to heart disease. Many people have heard of that. 1 of 8 women are diagnosed with breast cancer. October is Breast Cancer Awareness Month. There's pink everywhere. And this is, I think, really become part of our fabric to be aware, to say, let's screen, let's have regular routine mammograms. What many people do not know is that 1 in 5 youth will be diagnosed with a behavioral or mental health disorder. And this is a silent item that is impacting all of their lives and your lives as well. So 1 in 5 youth have an undiagnosed mental health disorder, which puts it as more common than breast cancer. Next slide, please. Some statistics, because statistics are always fun. 50% of all lifetime cases, as we said, of mental illness begin by age 14. Since the start of the pandemic, you may have experienced it in your own home, you may have experienced it with a friend's child, but hospitalizations for suicide attempts, unfortunately, have gone up 20% since the start of the pandemic. So these numbers would have been starting in March of 2020. There's increasing hospitalizations due to disruptive behaviors. This is true across the United States. As you can see, California has seen a significant increase as well. Something to note that suicide is the second leading cause of death among teenagers. So this is something we can do, and we can work as a community to help prevent. The Rady Children's Hospital of San Diego has a psychiatric ER, and they have seen a 1,700% increase in the number of patients who are presenting for care since the start of the pandemic. Next slide, please. During this time, as we'll say over the past 2 years, 1 in 3 high school students are feeling sad or hopeless. We're seeing a quarter of young girls are feeling depressed at least 4 days out of the week. 911 calls have increased by 10,000 per week. You may have seen the notice by our Surgeon General, Dr. Murthy, saying that this is a public health emergency. Our children are suffering. We have not provided that enough of a safety net for them. And many of them are suffering alone. 79% of young girls are feeling isolated. Adolescence is a time of change and challenge, and it is often teenagers feel like they have to deal with this all on their own, that they want to fit in, they don't want to look different, they don't want to stick out. And this is a time where we as parents, as teachers, as doctors, as nurses, that we need to lean in and help these children. Next slide, please. So 20%, as we said, 1/5 of children and adolescents will have a diagnosable mental health disorder. This diagnosis will occur prior to the age of 18. Next slide, please. However, 50%, half, will not get the help that is needed, which means they are not living up to their potential as a daughter or son, as the best student they can be, as the best community member they can be, as the best friend they can be. So 50% are not getting the help that they needed. Why is that? Sometimes parents are struggling with their own behavioral health, mental health diagnoses, so they're not able to be present in a way to get their child to appointments, to advocate for them within the school district. Sometimes they had the similar struggles when they were younger and they got through it. And they said, well, nobody helped me. Why do I need help? Just stop being lazy. Just get up and help yourself. And I think what people need to realize is that maybe they got through it, but they may not have had the most healthy coping skills. And if we can give that preventive care early, if we can help the brain develop in a way with healthy coping skills, then we will have far more productive adults in our society. And 50%, is there anything else in our lives where we'd be like, yeah, 50%, woohoo, that's great? No, we should want better for our children. We should want better for ourselves and our society. Next slide, please. So now that I've had a little bit of doom and gloom, what can we do about it? How can we recognize what is going on with our children and with our adolescents? So there's 6 categories that we're going to go over today. And these are things that you can see from the outside. Some of these are things that your child may be experiencing inside and may be hard to see, but we'll try to also talk about what are the objective things that you may notice. With all of this, it does require us as parents and caregivers to make sure that we're paying attention, that we are not distracted and overly distracted by social media, by our jobs, by just the day-to-day tasks of things that need to happen. So what do we see? We may see a change in our child's mood, right? They may be more irritable. Children and adolescents who are struggling with depression, irritability is actually one of the biggest signs that we will see. Often it's not that Hallmark special where they're sitting in their room with a pint of ice cream and watching movies. They're just really hair trigger cranky all the time. They may become more secretive. The emotions go up and down and up and down. And we know adolescence is a time of changing emotions, but this may be a lot faster. Next slide, please. We'll see changes in behavior. The A student is suddenly getting C's or F's, right? C's, the teacher may not notice, or you may be like, okay, well, they're still passing. There's a lot going on in their lives. But going from an A to a C is a big drop, right? For failing, maybe they're having more risky behaviors. You may see a change in their friend group, right? The people that they've been hanging out with since kindergarten, suddenly now it's an all new group and you don't recognize anyone. Maybe giving up those extracurricular activities that they had always enjoyed. They had a lot of self-worth, self-esteem, joy from, and now they're like, I'm not gonna play piano anymore. It's just like, whatever. Other physical signs you may see, maybe picking behaviors. So you may see some scarring starting to form, picking the nails, picking acne. They may be on you all the time, which you're like, okay, I gotta get some other things done. But that's their way of coming back and saying, you know what, I need reassurance. I need to know my boundaries and my safety nets here. You may see increased sexual activity. Often this is something that's not shared openly with parents, but when cleaning out the garbage can, you may find a condom, or you may find, if you're looking at your child's phone or computer, you may find evidence of pornography use. So these are things to be mindful of. Next slide, please. Changes in their sleep schedule. We all know adolescents like to stay up super late and they like to sleep in. They don't want to get up at 6 a.m. to do their activities. And they want to stay up late and talk to their friends. Like, well, everyone else is online and my friends aren't online till 2 a.m. So I should be allowed to stay up till 2 a.m. Adolescents really should be getting a good 8 to 10 hours of sleep every single night. When we have good sleep hygiene, then we're better able to deal with the stresses of the day. We're better able to deal if we're having ups and downs, better focus, better concentration. The other thing to remember, not just 8 to 10 hours every night, but the same 8 to 10 hours. So maybe they're going to bed at 8 o'clock on a school night, but then they stay up till 2, 3 a.m. on the weekend. Now you've blown through several sleep cycles. That's hard for your body to adjust and get back on track come Monday or Tuesday morning. Sometimes you'll see more sleep. Maybe they're coming home after school. If they got off roll at the end of the day, you'll see them coming home and taking a nap for 3 hours. That's also going to throw off the sleep cycle. It's harder to go to bed again at night at the usual time. So if you're going to take a nap in the afternoon, 30 minutes or less, so that way you don't go through the whole sleep cycle. The other thing is maybe we don't have any sleep. Maybe they're really completely out of whack and not sleeping at all. Next slide, please. Are there any physical changes in your child? Did they completely throw out their old clothes and come in with new clothes? Are you a child who used to wear short sleeves and tank tops all the time, and now suddenly they're wearing long sleeves? This is often something that can be done if a child is self-harming. Again, I'm not saying every child who wears long sleeves is self-harming, but that can be something where they hide it, or wearing long pants where they used to always wear shorts. Again, we're in Southern California, as we were talking in the beginning. It's usually pretty warm. It's unusual for someone to go around with a lot of layers. So if you're seeing that change, it is something to go ahead and reach out and look into. Are we seeing weight gain or weight loss? Either of those can be an issue. Maybe we're withdrawing from the family meal and we're just having everything at home. Hygiene is a thing that often parents will notice, that when somebody is feeling depressed, there is no energy to get up and take a shower, to put on clean clothes. I often say that this is someone, are they getting dressed from the floor, right? Whatever they dropped last night, are they just putting back on? Are they just wearing the clothes that they slept in, roll out of bed and go straight to school in that? Have they combed their hair? So kind of basic hygiene, brushing your teeth is something to take a look at. Next slide, please. This one's really challenging because your brain is inside your own head and you really only know your own thoughts. We rely on other people to use words or use writing or use sign language to express their thoughts. And so this one can be very hard for parents and caregivers to see. but some signs that there's been some change in thoughts. Maybe we're having increased anxiety, especially in adolescence. That anxiety piece is often kept inside and they look like they're doing great until they're really not, and then they completely fall apart. So negative self-talk is a big one. You know, I'm not very good at that. You know, I'll what's the point in trying? You know, they're trying, they're like, yeah, and they crumple it up, or it takes 5 times to get through a paper because it's just not quite good. Loss of interest in activities that previously they had enjoyed, withdrawing from family activities. Next slide, please. And then looking at their social arena. Who are their friends? I always encourage parents and caregivers, if your child's on social media, you need to be on the same platform, right? The adolescents are not on Facebook. They're also, you know, there's TikTok and there's Instagram, that you need to be on there, and you should be following your child. You need to be in their friend network. You need to see what they're posting. Sometimes kids will have a public account and then also a private account. This is also a way that other people can be bullying and making fun of people by creating fake accounts. So being present, understanding how these platforms work, and realizing that technology is a tool, and we should be using tool for good, as we say. If we are seeing someone who's withdrawing socially, you know, friends are still calling, they're still coming around, but your child's always like, they're busy, they're tired, I don't have time for that, is something. Looking at changes. Lots of fighting, you know, again, that irritability coming out is something to look for. Next slide, please. All right, so we've seen the statistics. We've seen some of the signs of what to look for objectively. Now, this is the best part, which is how you can help, because the answer is absolutely you can help. And these are, I really like to go for things that are concrete, that are action-oriented, that anybody can do, and that don't cost a lot of money, because there's plenty of other things to spend, plenty of things we have. So what can you do to help? I think one of the biggest things is to listen, really listening to understand, not listen to respond. So as a parent, often our kids come to us and we immediately want to fix it, right? There's a problem, there's a challenge, we want to help there. Just like when they were little, they fell down, they scraped their knee, we're there, we got the Band-Aid, the antiseptic, the kisses, whatever it is to take to fix it. We're in that mindset. So something to do is listen to what they say and then pause. Let there be silence until you're sure they're really done talking. And then when they're done talking, repeat back to them. What I heard you say was, what I think you meant was, are you feeling? So ask them, repeat back in your own words, give them that opportunity to correct you and say, no, Mom, you got it all wrong. Or like, yeah, that's exactly what I was trying to say. And then ask them, did you just want me to continue listening? Or would you like me to come with a solution and problem solve with you? Not for you, but with you. Because in the end, what we're trying to create are independent young humans, right? People that can problem solve. So again, listening to understand, not listening to respond. Setting aside time every day. How do we create that new habit? We set aside time. How do we begin meditation in the morning? We say, okay, 5 minutes every morning, I'm gonna meditate. And then you're consistent with it, right? It takes 21 days to make a habit. For people who have challenges with attention and focus, it can take 100 days, 100 times of doing the same thing to create that same habit. So I encourage you to be persistent. If it's worth doing well. 15 minutes per child per day makes a huge difference. Again, this isn't 15 minutes doesn't have to go to Chuck E. Cheese or Disneyland. It can be 15 minutes where we bake a cake together. 15 minutes where your kid likes to shoot hoops. You're not so good at it. Get your tush out there and start shooting basketball. The YMCA has basketball hoops. This is a great place to go together. Invite your kid on a date. They feel so special. You get to dress up, they get to dress up. The date can be in your home. The date can be somewhere they want to do. I mean, the date can be a grocery store and they get to pick out one fun item for themselves. So again, thinking about stuff that they want to do, that they want to be engaged in, because the whole idea is you want to get them talking about what they're interested in. Another idea I use with families is keeping an open diary. I think a lot of us have heard of the concept of a closed diary. That's where you're writing things for yourself to review later. An open diary would be, same spiral notebook, cute thing, whatever you have. Your child will write something or draw pictures, and then they leave it under your pillow, and then you read it at a later time. You write some stuff back, and then you leave it under their pillow. So it's a way of continuing conversation without having to feel you have to be eyeball to eyeball, which sometimes can be very stressful, right? The child is worrying, if I say this, maybe my parent's going to be upset. Maybe they won't think as well of me because I'm struggling. Remember, the executive functioning part of our brain doesn't start developing, that frontal lobe, until age 12. And it finishes developing at age 25. Later, if you have ADHD, anxiety, depression, anything else. So at age 12, they start to become aware of these things and aware of people around them and how do I plan ahead? But it's really in its infancy. So thinking about that and giving some space and some grace there, taking an interest, as I said, in their hobbies is really important. With the open diary, I've had some families will make a mailbox, especially for the younger kids. So again, this is arts and crafts activity you can do together, and then you get mail, which is so exciting. Next slide, please. So again, the screen, media, it's a tool, and teaching your children how to use this tool for their own benefit, right? We don't want the tool to use us. We use hammers, we use saws to build houses. We can use social media to stay connected. We can use it to take a break, but does it then become 2 hours of our day where we could have felt a little better about ourselves if we had spent 30 minutes on social media and then we spent, an hour baking a cake and then delivering cupcakes to our neighbors. Having a shut-off time for Wi-Fi, turning off electronics, you will receive pushback from this from your adolescents. I encourage you as parents and caregivers to have a end time. If this is a challenge of turning in the electronics, keeping the electronics out of the bedroom, changing the Wi-Fi password, right? There's certain activities and then you get the Wi-Fi password. Having interactive games with your children, age appropriate, of course, but there's many things that can play across many levels, and your older children and your younger children will get much social benefit by learning how to play with each other well. And then they see that you're sitting down enjoying. I think the game on the screen is Monopoly, but there's Othello, there's big pieces, little pieces, you can do Lego together. If you are looking around your house, you're like, okay, we're gonna put away the electronics and we're gonna have an electronic-free day. It's an excellent idea. We do it at our house. I think it's fantastic. However, you have to do a little prep time as a family. You can't take away something and then leave a vacuum. So prior to saying, okay, here's the day we're gonna have no electronics, or here's the evening we're not gonna have, you have to start pushing in with introducing the idea of board games, introducing the idea of a gratitude half hour where we all share things about each other and get that habit started. And then it'll be much easier and you won't feel as much resistance. It'll just sort of naturally fall away that we don't have electronics during that time. Next slide, please. This was an idea that came from my children, actually, is the rose and the thorn and the bud. And it's a very structured way of thinking about how do we share about our day. It requires you to slow down and to connect with each other. So the rose is what went well. What was something you're like, yes, that was a win today, right? What went well today? That's your rose. Your thorn is what was your challenge? What was something that you thought, didn't go quite like I thought it would be, or made me feeling a little down. And then the bud is what am I looking forward to, right? Because this is something that's really important, and often, again, with our children and adolescents in specific, come very down in the day, and it's very hard to see into the future. And if we can think about what are we looking forward to, get us forward thinking, we can plan then for the future. So again, what went well today, what was challenging for the day, and what are we looking forward to? And again, with any new habit, you as a parent or caregiver, really important to make sure that you are modeling this behavior. So you go first, right? You show them how it's done, and then it's going to be much easier for them to do it as well. Next slide, please. I'm a big proponent of the family meal. So family meal is some adult and some children, right? And so this is going to absolutely look different in every family. So every family is whoever's living under the same roof within the same walls. And the family meal will look different. Some families have breakfast be their big time where everybody can be together because everyone's there. After school, you may be going to baseball or softball or drama or band or other activities, volunteering. And breakfast is a time where everyone can get up and be together and have that nutritious meal. You want to model the foods that you want your child to eat, right? So one meal, whole family. Obviously, if you have a child or adult who has any food restrictions due to medical reasons or they have food allergies, please do not feed them those foods. But otherwise, trying to have it be more or less because you want them to see, yep, I value your nutrition, your body just as much as I value mine. Or asking a child to have a salad when the parents are having burgers and french fries, that's not gonna work as well. Putting the phones away, no electronics. And again, modeling that behavior that the adults also need to turn off the TV, turn off the electronics. And in general, if we're doing that, then, if once a week we have family movie night and we eat popcorn and apples and carrot slices and cheese slices, in front of the TV, then that becomes special and that becomes the exception, not the normal. The other thing to think about is sometimes some families have staggered dinner times, right? This section of family is able to be home for dinner at this time, this section of family is able to be home for dinner at that time. That's fine, you can still do a family meal with whoever is home at that time. Next slide, please. When I learned about this, I thought this was really just so powerful that all it takes is one trusted adult. There's more and more research going on now about resiliency. So we all have events that have happened early in our lives. You may have heard of the concept of adverse childhood experiences or ACEs. And this is knowing that things that happen early in our life and people who have a higher, what they call ACE score, more likely to have challenges later in life. So more likely to potentially have diabetes, high blood pressure, self-harm, anxiety, depression. And what is one of the things that helps that? How are some people we're finding are more resilient than others? One of the big resiliency factors is having one trusted adult. One. So before we were like 50% of people aren't getting help. That wasn't such a great number. Now we're talking about one. I mean, how many times in life can you say one thing makes a difference? One trusted adult makes a difference. And this could be a parent, grandparent, aunt, uncle, coach, religious leader, teacher, somebody in the neighborhood. One person that child feels, you know what, they got my back. I can talk to them about anything. They look at me with that look in their eyes that I am fantastic, I'm fabulous, I'm gonna do well in life. That leads to greater engagement in school, which means graduation rates go up. It means we have more interaction with community activities. The child's more likely to achieve their own personal goals, better physical health, right? When we feel good about ourselves, we eat healthier. We eat healthier, we feel good about ourselves, and it becomes a very positive feedback loop. And then we have more resiliency. When they're seeing that somebody modeling that behavior for themselves, they're more likely then to model that behavior for somebody else. Next slide, please. Your community is here for you, right? Do not feel that you ever have to deal with any challenge alone. So please talk to your pediatrician, talk to children. I work for a children's primary care medical group. We have 2 offices here in La Jolla, a Regent's office, as well as over on Girard Avenue, over by La Jolla Elementary School, down in the village. Your YMCA, they're putting on this amazing webinar to make sure that this information is getting out there. As we said, it'll be recorded, it'll be available for later viewing, so please feel free to share this with your friends and family. Your YMCA has locations all over the county. They do have therapy services that are available through the YMCA. So again, contact, reach out. The La Jolla Community Center is another great resource here within La Jolla. Next slide, please. What do I do in an emergency? The Rady Children's Hospital is the only children's hospital in the county. As I said, they have their emergency department. They also have a psychiatric emergency room. So this is a separate part of the emergency room. You access it the same way through the same door, but a separate part that's set up for kids who are struggling. with behavioral mental health diagnoses that have come to crisis point. They are struggling with self-harm thoughts or behavior that parents feel like, I can't, it's a quieter space, the ratios are different, psychiatry and social workers are right there. Rady Children's does have a behavioral health urgent care located down in Mid-City. They have walk-in clinic, they have appointments, and then our access and crisis line, crisis text line, if you prefer texting versus calling, and the National Suicide Prevention Lifeline, which is 800-237-8255. And I say the number out loud. I think it's so important that everyone takes the time right now, put that phone number in your phone. And I say that not because I'm necessarily concerned about your child, but maybe you are, but you don't know, you may be that trusted adult to somebody else. And they may come to you, I don't know what to do, I don't know what to do. You can start with calling the National Suicide Prevention Lifeline, right? And they have trained counselors there on the line to help talk you through it. Next slide, please. San Diego County resources. Smart Care Behavioral Health Consultative Services, the parent line is up at the top. This is an amazing resource. It is free, which is my favorite four-letter word. It's a free service that is paid through by your county taxes and will help guide you through. I need help with how do I get my kid to this service? I need help navigating the insurance portal. I think my grandparents are struggling in some way. This is parent line. You said they talk, they do a needs assessment, and they help you navigate the system in conjunction with your pediatrician. So once you've done that, they'll send a copy of that information to your pediatrician if you'd like. And that way, when you see them again, your pediatrician can then say, hey, how did that go? What's going on? How can I help you more? 211 San Diego, again, connect with services. San Diego Food Bank, the website is up there. It shows you all the locations across the county. If there's not getting through for the month with food, please reach out to the San Diego Food Bank. It's up to us. Obviously, Children's Primary Care Medical Group, we have a blog and other resources on our website. Rady Children's Hospital San Diego has fantastic. We are all present on social media, hopefully posting positive content. Jewish Family Service does do a safe parking program. So if any of our families are unhoused and they're living with their car, they can park in a safe place. They have a hot meal with their children and then help get connected through social services and get back into permanent housing. Next slide, please. Professional organization, the American Academy of Pediatrics has healthychildren.org, which is a wealth of information for parents and caregivers. And then obviously we have our county and American Psychiatric Association. Next slide, please. So the whole point here is that we're talking about the whole child, right? We're talking about how do we fit within society? How do we have our mind and our emotional and behavioral goes with our physical health? And if we don't have everything together, we're not good functioning human beings. And so thinking about whole child care and talking about that. So thank you so much for your time today. Thank you for listening. I think we're proceeding now to the Q&A section because I see Callie's back on and I've stopped talking.
Yes. And thank you so much for your time and wisdom, Dr. Bowers. It's always a pleasure getting to listen to you. And as a parent myself, I really appreciate your recommendation to listen to our children to understand and not listen to respond. And also the idea of setting aside 15 minutes each day for each child. It's a simple, tangible step that can be implemented in real time. So thank you for all of your helpful tips and recommendations. At this time, yes, we're open to any questions if anyone wants to add anything into the chat. And we also have a few questions to ask. Dr. Bowers, let's start with the first question, which is, how many signs or symptoms should I be looking for in my child before I reach out for more help?
So it's an excellent question. I think this is one of these times where I rely a bit on my spidey sense. You know, what's your tingling? It could be one thing, but it could be a major thing, right? So maybe the only thing that's changed is now your child is sleeping a lot, right? They're going to bed at 9 o'clock. They're not getting out of bed till 2 in the afternoon. That's it. Otherwise, they got good hygiene. They're coming to meals. They're socializing with friends, but they're spending this vast majority of time sleeping. That's not okay. That should be talked about. Sometimes it could be a lot of things. It could be just maybe they seem a little bit more cranky, maybe they're wearing a little bit more of this, maybe they have a couple different friends, and it is a little slower over time, where you then reach that point where you're like, wait a minute, 1 and 2 and 3, and you're trying to juggle all these differences, and then suddenly it's like, boom. It becomes, way too much to handle. So if you as a parent are feeling overwhelmed or feeling concerned in any way, go and talk to your pediatrician. Absolutely reach out for help. There are no silly questions in life.
Thank you. Thank you for that answer. We have another question, which is, what is the best way to talk about this with my child, and how can I open up that conversation?
So thank you. So I think open and honest. Often as parents, we try to, what I call info dump, right? So some of you may have come to this webinar and now you're like, all right, I'm ready. I'm here. I'm going to talk about behavioral mental health of my kid. We're going to go home. We're going to sit down. We're going to have this conversation. Your kid may not be ready for it. And so I think having that open mindset is very important. Make sure you're listening to what they say, and then share your own stories. Right? So again, you don't always have to come with a solution, but your kid's going into 7th grade, share some stories of what it was like for you when it was in 7th grade. And I know a lot of us have, the horror stories of junior high and middle school, but also share those ones of the successes, right? Yeah, this was a real challenge, but this is how I was able to take that and make it a positive experience for myself, right? Or it never became a positive experience, but this is who I reached out to for help. So again, sharing your stories, it helps your kids go, oh, wait, my parents were 14 once, that's right. And make you feel a little more human, I think is important. And just being open and being willing to have that conversation. Stop talking, right? They ask you a question, answer it, short, brief, wait. Did I answer your question? Give them the opportunity for a follow-up question, because often what will happen is we think they're going one direction, but really they're going the other directions. And so giving that opportunity for that follow-up conversation. Sometimes they'll be like, no, I'm good, see ya. But they know that you're always available to come later. And just say that, hey, follow-up questions, I'm always here. Office hours are 24/7.
That's a great idea. Office hours, 24/7. Okay, and then the third question is, how can we as parents approach these conversations about mental wellness in a proactive way as opposed to a reactive way?
So, with proactivity, that means your eyes are open, your ears are open, and your mouth's closed. I would say, we have 2 ears and we have 1 mouth. So we should probably be doing about twice as much listening as we are talking. But are we scanning the room? Are we getting a sense of what's going on? And paying attention. If there's something, maybe you're watching a movie together. I think being involved in your kid's life, knowing what movies they're watching, knowing what TV shows, watch the same ones, and you'll see characters go through particular experiences. And you could ask your kid, like, wow, that looked really tough for Joe. She went through X, Y, and Z. Any of your friends ever had that happen? Always talk about the friends, right? Keep it open. Or ask them, is this something that you've ever experienced? No. Okay, well, this is, or share, hey, this is something I totally went through, and this is how it impacted me, and this is what I did. So I think having it and sharing, having these conversations, and it's not just, come to me if you have a broken arm or if you have a stroke, come to me when you're having a bad day, right? Just make this that talking about mental health is just like anything else we talk about. It's no big deal.
Thank you. Thank you for that. We also just had another question come in from Vincent Glorioso. And he asked, you had mentioned the period of adolescence being 12 to 24 years. Can a child grow out of these mental health challenges?
So what we can do to help the kiddos and us is, what we do is we learn how to adapt, right? So a child who, say, I'll use ADHD for an example. Child who is diagnosed with ADHD doesn't not have ADHD when they're older. They have just learned really excellent coping skills, hopefully, fingers crossed. We've been able to teach them really good behavioral modification, good coping skills. So we're helping to rewire their brain so they learn how to use their brain in the positive, creative, outside of the box thinker that they are, right? So, they can hyper focus on something they really, really like. They're very creative, often making connections that other people may not have made, and finding that and nurturing that side then makes them be very successful. Again, to continue with ADHD, often it's the younger kids that we see that hyperactivity piece, that movement piece that can be disruptive in a factory classroom setting. But if they're older and they still have the need to move, finding a job and finding a purpose in life where they're allowed to move, right? Maybe they become an EMT where they get to, it's lots of different excitement. There's always something going. They're an expert in the field, but having someone like that sitting in a desk job where they have to sit in front of a computer for 8 hours every day, stamping reports, they're not going to be successful in that. So part of it, our job as parents, is finding ways to cultivate their skills and really helping to grow with that. So do people outgrow the diagnoses? No, but do they learn how to recognize it a little better? Do they learn how to use their coping skills, right? So again, if we have an adolescent who had a very significant depressive episode, maybe they were self-harming, we've activated the bat phone, we got the pediatrician, the therapist, maybe psychiatry involved, and now they're at a place where they feel more functional and whole. They're better able to recognize in the future if they have a little depressive episode or a big depressive episode, and hopefully they recognize that sooner and able to activate all their supportive network. Hopefully I answered that question.
Well, thank you so much, Dr. Bowers, for your time, for your expertise. And as we wrap up today's webinar, we want to thank everyone in attendance and the Dan McKinney Family YMCA. And again, yes, Dr. Bowers and for her time and expertise. We hope everyone has a wonderful day, and remember that this recording will be sent out at a later date.
Thank you so much.